Mental health is an expansive and multifaceted field encompassing a broad spectrum of conditions and issues that affect how individuals think, feel, and behave. Understanding specific mental health conditions and the nuanced topics related to them is essential for effective prevention, early intervention, and appropriate treatment. This article explores several key mental health conditions, their symptoms, causes, and treatment options, while delving into related topics impacting mental well-being across different populations and life stages. Anxiety disorders are among the most common mental health conditions worldwide. They include generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. Symptoms: persistent worry, restlessness, fatigue, difficulty concentrating, muscle tension, and sleep disturbances. Panic attacks, sudden episodes of intense fear accompanied by physical symptoms like palpitations, are common in some types. Causes: genetic predisposition, brain chemistry, personality traits, and environmental stressors contribute to the development of anxiety disorders. Treatment: cognitive behavioral therapy is highly effective. Medications like SSRIs and benzodiazepines may be prescribed. Mindfulness practices, lifestyle changes, exposure therapy, and psychoeducation can help patients develop long-term coping strategies. Additional considerations: anxiety may manifest differently across the lifespan and in diverse cultural contexts. For example, children with anxiety may exhibit somatic complaints, while older adults might underreport symptoms. Stigma may also affect help-seeking behavior in specific communities. 2. Mood disorders include conditions such as major depressive disorder, bipolar disorder, and dysthymia. Symptoms of mood disorders can vary greatly, but here are some common ones to be aware of. Depression often manifests as persistent sadness, feelings of hopelessness, a loss of interest in activities once enjoyed, changes in appetite or weight, sleep disturbances, and even thoughts of death or suicide. Bipolar disorder, on the other hand, is characterized by alternating episodes of depression and mania. During manic episodes, individuals may experience elevated mood, impulsivity, inflated self-esteem, and a decreased need for sleep. The causes of mood disorders are multifaceted, involving genetic, biological, psychological, and environmental factors, including adverse childhood experiences. When it comes to treatment, options include antidepressants, mood stabilizers, psychotherapy, and lifestyle modifications such as regular exercise, good sleep hygiene, and proper nutrition. Psychoeducation and family therapy have also proven effective in reducing relapse rates. Preventative approaches are equally important. Workplace mental health programs, school-based mental health education, and community support systems play a crucial role in reducing the prevalence and severity of mood disorders. Trauma and stressor-related disorders encompass conditions like post-traumatic stress disorder and acute stress disorder. Symptoms can include flashbacks, nightmares, emotional numbness, hypervigilance, irritability, difficulty concentrating, and avoidance of trauma-related cues or reminders. These disorders often stem from exposure to traumatic events such as accidents, assault, abuse, natural disasters, or military combat. Childhood trauma and cumulative stressors can further increase vulnerability to these conditions. Trauma-focused therapies like EMDR, trauma-informed CBT, somatic experiencing narrative therapy, and group therapy, peer support, community involvement, and building resilience are essential components. Special populations such as first responders, refugees, survivors of domestic violence, and marginalized groups often face compounded trauma, requiring culturally sensitive and context-specific interventions. Obsessive-compulsive and related disorders. These include obsessive-compulsive disorder, body dysmorphic disorder, and hoarding disorder. Symptoms: OCD involves intrusive thoughts and repetitive behaviors aimed at reducing distress. BDD is a preoccupation with perceived flaws in appearance, often leading to grooming or cosmetic procedures. Hoarding is characterized by difficulty discarding possessions, leading to cluttered living spaces and impaired daily functioning. Causes include neurological differences, serotonin imbalances, family history, and traumatic experiences. Treatment options are CBT, especially exposure and response prevention, SSRIs, acceptance and commitment therapy, and in severe cases, deep brain stimulation. Prognosis improves with early intervention. Psychoeducation and support groups enhance treatment, adherence, and emotional resilience. Eating disorders, anorexia nervosa, bulimia nervosa, and binge eating disorder fall under this category. Symptoms: anorexia, extreme restriction of food, intense fear of weight gain, distorted body image; bulimia, binge eating followed by purging; binge eating, recurrent excessive eating without compensatory behaviors, often accompanied by guilt or shame. Causes: cultural pressure, body image ideals, low self-esteem, family dynamics, trauma, and co-occurring mental health issues, such as anxiety and depression. Treatment: nutritional rehabilitation, individual and family therapy, cognitive restructuring, dialectical behavior therapy, and, in severe cases, inpatient or residential care. Long-term management, relapse prevention strategies, self-compassion training, and building a positive relationship with food are critical. 6. Personality disorders. This group includes borderline personality disorder, antisocial personality disorder, narcissistic personality disorder, and others. Symptoms: BPD, emotional instability, fear of abandonment, impulsivity, chronic feelings of emptiness, and self-harm. ASPD, disregard for others' rights, deceitfulness, impulsivity, and lack of remorse. NPD, grandiosity, need for admiration, superficial relationships, and lack of empathy. The causes of personality disorders can be quite complex. They often include genetic vulnerabilities, early childhood trauma, neglect, and disrupted attachment patterns. When it comes to treatment, long-term psychotherapy is essential. This can involve dialectical behavior therapy, schema therapy, and mentalization-based treatment. Additionally, medication may be used to manage co-occurring symptoms. People with personality disorders often face significant challenges. Stigma and treatment resistance are common barriers. Establishing trust and a strong therapeutic alliance is absolutely critical for making progress. Now let's move on to neurodevelopmental disorders. These include attention deficit/hyperactivity disorder, autism spectrum disorder, and specific learning disabilities. Let's talk about the symptoms and causes of neurodevelopmental disorders. For ADHD, symptoms include inattention, hyperactivity, impulsivity, and challenges in academic and occupational settings. For autism spectrum disorder, you'll see social and communication difficulties, restricted interests, sensory sensitivities, and repetitive behaviors. The causes are often linked to genetic inheritance, prenatal exposures, and structural brain differences. Treatment often includes behavioral interventions, occupational therapy, social skills training, medication. Parent training and advocacy play a vital role. Social considerations like stigma, lack of access to resources, and insufficient support systems can hinder development and inclusion. Moving on, and other psychotic disorders. These include schizophrenia, schizoaffective disorder, and delusional disorder. Symptoms of psychotic disorders can include hallucinations, delusions, disorganized thinking, cognitive impairment, flat affect, and a significant decline in functioning. Causes often involve a genetic predisposition, neurochemical imbalances, prenatal complications, and psychosocial stressors. Treatment typically includes antipsychotic medication, psychosocial interventions, CBT for psychosis, supported housing and employment, and coordinated specialty care for early psychosis. From a recovery perspective, while psychotic disorders are often considered chronic, many individuals can lead fulfilling lives with appropriate support, challenging traditional misconceptions. Now let's introduce substance use disorders. SUDs involve the misuse of alcohol, prescription medications, or illicit drugs. Symptoms include cravings, tolerance, withdrawal, symptoms, inability to control use, impaired social or occupational functioning, and continued use despite consequences. Causes can be varied, including genetic predisposition, trauma, peer influence, early exposure, mental health comorbidities, and socioeconomic factors. Treatment often involves detoxification, medication-assisted treatment such as methadone or buprenorphine, cognitive behavioral therapy, contingency management, 12-step programs, harm reduction strategies, and relapse prevention. Rehabilitation approaches that combine individual counseling, group therapy, vocational training, and family involvement tend to yield higher success rates. X. Co-occurring disorders, also known as dual diagnosis, refer to the presence of both mental health conditions and substance use disorders. Many individuals experience both mental health conditions and substance use disorders, often exacerbating the course and severity of both. Co-occurring disorders complicate diagnosis and treatment due to overlapping symptoms and increased risk for poor outcomes, including homelessness, incarceration, and suicide. Treatment for co-occurring disorders typically involves integrated dual diagnosis treatment, often within community mental health centers. This involves coordinated care, case management, motivational interviewing, and peer support specialists. Policy considerations. Funding and systemic barriers must be addressed to expand access to integrated care models. 11. Digital mental health is on the rise, with teletherapy, mental health apps, virtual reality for exposure therapy, and AI-driven diagnostic tools becoming more prevalent. Cultural competency is crucial, highlighting the need for culturally sensitive assessment, communication, and treatment planning approaches to address disparities. In the realm of LGBTQ+ mental health, there is a higher prevalence of anxiety, depression, suicidality, and discrimination. Affirming care environments and support networks are vital. Workplace mental health issues such as burnout, vicarious trauma, work-life balance, and the role of employers in promoting psychological safety are increasingly recognized. For youth and adolescents, early detection, trauma-informed school system, social media impact, and the role of parents and educators are key factors. Lastly, aging and mental health encompass dementia, late-onset depression, social isolation, elder abuse, and the importance of caregiver support and geriatric psychiatry. In closing, understanding specific mental health conditions and related topics is critical in reducing stigma, fostering empathy, and promoting holistic care. Mental health is not one size fits all. Biological, psychological, and social factors shape each individual's experience. As we deepen our understanding and broaden access to effective interventions, we move closer to a society that values mental wellness as an integral part of overall health. Continued advocacy, innovation, and compassion will ensure a future where everyone has the opportunity to thrive mentally and emotionally. For mental health services, visit https://www.rivernorthcounseling.com or call now 312-467-0000.